welcome everybody. I'd like to introduce you to a very special young lady called Layla. Layla is accompanied here today with her mum Marie. Layla was first diagnosed at the age of 8 in 2021 with ITP. And I'm just going to ask Layla some questions about her condition, how she's managed it, how she's found it. Also ask Marie, her mum, how she's coped with a child with ITP. So, Layla, over to you. When you was first diagnosed with ITP, immune thrombocytopenia, did it, was it a shock or, did it come as a shock to you?
Kind of, yeah.
Yeah. What did the doctors say when they told you? This is probably one for mum, really. So, but yeah.
Well, can you remember?
Not really.
No, sure. It's all a bit of a blur for all of us, really, but it was unexpected. Initially, Layla was having difficulties she felt there was something in her throat, so probably something completely not connected. We were getting her in to see a GP at the time, but it was bang on lockdown on COVID, so we couldn't get her in to see anybody. So it meant me trying to have a video appointment using my telephone as a camera and a torch down her throat to see if we could see what was going on. Obviously, that didn't work. This carried on throughout the summer till eventually we got to see a GP in September 2020. They said they couldn't see anything going on, but asked if we would like to have some blood tests taken, which naturally the answer was no, but obviously, we wanted to get to the bottom of what was going on. So we had the blood test done, and that night we got a call saying that there was an issue with the platelets, and we ended up straight through at the hospital that evening. It was a bit of an ongoing thing between that September through to January.
Did they say what the platelet count was when they phoned you up?
At the very first one, so before diagnosis, it was 71. But then as time went on over the course of the next few months, they just started to gradually get lower. And then at the point of, can you remember what the platelet count was when you got diagnosed?
22.
22, right. When they finally diagnosed that you had ITP, had you had any other symptoms, any bruising or bleeding or fatigue at all?
Like all of them, but I had like lots of nosebleeds to start with.
Okay. And then the small little red dots, they call it petechiae. Did you have that on your skin?
Yeah.
As well? You did, right, okay. Can you remember what other tests they did on you, to sort of rule out other things before they got down to to saying it was ITP?
They did like lots of blood tests.
Yeah.
Yeah, they just did like loads of blood tests and stuff.
And then the biopsy, wasn't it?
Yeah.
It was what, sorry?
And then the biopsy, it was just a number of blood
Biopsy.
tests.
Okay. So when you was first diagnosed, what was the feedback like that you got from the consultant who was looking after you, your care? Was you pleased with it? Yeah.
Yeah, I mean, the feedback was good in one respect because it had ruled other things out. But again, ITP wasn't something that any of us really knew anything about. So it was a bit of a learning curve for all of us, wasn't it? But
yeah.
The feedback and the support that we got was, we can't fault that at all.
Good stuff. Excellent. And so what treatment plan did the hospital put you on once you was diagnosed?
They waited a bit, and then they gave me like medicine and tablets, I think.
So that was the steroids. She started the steroids in July 2021.
So 6 months afterwards, basically, after first diagnosis.
Yeah. They started her with a course of 4 days, I think it was, of the steroids, which had a vast improvement with the platelets, but then very quickly they went back to normal. And then it was just a watch and wait. She did get COVID, and can you remember what they went to when you had COVID?
549.
They went straight up, did they? It's
Yeah.
amazing how many people have said that.
Yeah, well, we were worried. I mean, everybody was worried about COVID, weren't they? But I guess we were extra worried because we thought it might go the other way.
Yeah,
And
yeah.
more
Well,
of
it
a
did for lots of people. It
yes,
did. Yeah.
But you know, you like to be different, don't you, Layla? So yeah, shot up to 549, and then again went back down. So after some more months of watch and wait, they then started on the Altroma bag in
Yes.
May last year, wasn't it?
Yeah.
And has that had the right effect? Has the count risen?
Yeah.
What is your platelet count now?
232.
Oh wow. Well, you must be very pleased
Yeah.
because with a count like that, you can now do sort of normal things at school as well, can't you? Sports and what have you. So yeah, rather than being on the sidelines, being very careful with a low count. So, which is excellent. Because that leads on to my next question. Many children say one of the worst experiences of ITP is not always being able to join in with activities at school. Did you find that when you was first diagnosed? Was you wary of or a bit cautious about joining in with sports and other things at school?
Yeah, so in primary, when it was like break time or lunchtime, I got kept inside.
Yeah. Were the teachers understanding? Did they know about ITP?
Yeah.
They did. Good stuff, which is excellent. I know we talked about the symptoms you had, but now your count's on the up, so to speak. But in the interim 3 years, did you have any fatigue, etc., and all that? Any tiredness as a result of your count being so low, your platelet count being low?
Yeah, I was like tired a lot.
Yeah. Okay. Which is another thing, which is, for school children, is very hard to actually take in, isn't it? When they have fatigue as well, because they've got all the schoolwork. I bet you get loads of homework now, don't you?
Not really.
You don't? You will.
Primary school, didn't you?
You will. You will soon. So excellent. I know I mentioned that the common symptoms about bruising and petechiae. Did you have any bleeding at all?
Yeah, like loads of nosebleeds, and I also
Yeah.
when I had like a cut, it would like bleed a lot.
Yeah. Any mouth blisters or blood blisters in the mouth?
No.
No. Oh, you're lucky. Good. Which is again is another fairly common symptom with people. Moving on now to your daddy climbed a very, very tall mountain in Africa. When he told you what he was going to do, what was your first reaction?
I thought it was amazing.
Yeah, good stuff. But, you must be very proud of him.
Yeah, I'm very
Yeah,
proud.
and his friend Richard. Yeah, the two Richards. Yeah. So they travelled all the way to Africa. They raised a hell of a lot of money, for a number of good causes, including ITP and other good causes as well. They managed to get to the top of what I believe is the tallest freestanding mountain in the world, which is marvelous. And the pictures I've seen, and I will be showing some pictures tonight when I do your daddy's video recording, but the pictures I've seen, the scenery looks breathtaking. So did he phone you up when he was there? Did he speak to you when he was there?
Yeah.
You did? Yeah, good stuff.
Phoned a couple of times, but it was very, very bad signal, wasn't it? So
Yeah.
he did call when he could, but
It's
yeah.
probably a bad signal like it is here where I live. Yeah. So,
Yeah.
right. So yeah, I bet you're very, very proud of your dad's achievements and that. Has you got anything else planned for the future? Any more,
I don't know.
heroic wacky ideas to do, or
He's looking for his next challenge, isn't he?
Yeah.
is he? Oh God, she says trepidation. Right. Last question now, unless you've got anything else to say, but what would you say to any other youngster your age, younger or slightly older, who was told they have ITP? Would you have any advice to give them?
Yeah, I would tell them not to worry about it because it will get better.
It will get better. Good stuff. Because I must say that normally in adolescence, children with ITP, 80% of them go into remission within the first year. So you are one of the unlucky ones, really, I'm afraid. But you're looking really well. Your count's really good now, and your dad is doing wonderful things, and you've got a lovely mum there as well looking after you. So, Layla, Marie, thank you very much.
Thank you. And thank you and your association for everything that you do and all the support you provide to us.
No problem.